Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient which you had requested. The area of interest is the wisdom teeth on the lower right and the lower left hand side. Moving to the lower right hand side, this is a vertically impacted wisdom tooth that you can very clearly see. This is the transaxial view, which is basically the proximal view. And here you can very clearly see this is the mesial aspect of the wisdom tooth. This is the mid root level. The wisdom tooth is one associated or enkylosed with the bones, so we don't see any major PDL space here. It is right on top of the inferior nerve marked with orange right here. This is the lower right hand side. It is not enveloping it, but as you can see, it pretty much covers the inferior alveolar nerve and is also compressing the inferior alveolar nerve from all angles. It has a very thick cortical plate on the superficial aspect. It is very much ankylosed with the cortical plate on the lingual aspect as well as on the buccal aspect. So there is osteosclerosis associated with this tooth as well, as you can very clearly see this lesion right here. This is right on the distal aspect of the wisdom tooth, and you can see it just blends in with the osteosclerotic bone. This is the axial view. This is the lower right side, and as you can again see, we've got very severe bone very severe bony ankylosis associated with the tooth, its root, and absolutely no PDL space can be seen. Even in the interradicular area, we've got very severe bone ankylosis, and here you can see the wisdom tooth compressing the inferior alveolar nerve. This is the lower left hand side. Now this is a mesioangular or horizontal impaction. The tooth is not completely covered with bone, but majority of the tooth is in the ramus. You can see again very limited PDL space here. We don't see any marked PDL space between the tooth and the bone. Again, very ankylosed tooth. You can again see that both there is a radio opaque bone or osteosclerosis between the two roots as well. And also you can see that the mid root level now compresses the inferior alveolar nerve on the left hand side as well. And here also you can see that both the roots are very closely associated with the inferior alveolar nerve. This was the mesial root. As soon as the mesial roots finish, even the distal root is very closely associated and is also ankylosed with the lingual cortical plate as well. This is the axial view of the lower left hand side. Here also you can see this is where the bone is, the osteosclerotic bone or the radio opaque bone shows first, then we see the ankylosed tooth, and here also we can see that there is a small feeder vessel developing here. So this is also something to be kept in mind when extracting, if extracting, because this is an area which will lead to a lot of bleeding as well. If you have any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. This is the coronal view, and here also you can have a very good idea of how both the wisdom teeth look simultaneously in this patient. Thank you very much.